Hello. Today we will be talking about medication education for part of our annual training. To begin, it is important to understand our patients' rights when it comes to psych medications. Patients have the right to receive information about the major types of prescription medications which their doctor has ordered for them. Patients have the right not to be given medications they do not need or too much medications. Patients have the right to refuse medication unless the patient's condition places them or others in immediate danger or medications have been court-ordered. Legal concerns for medications. According to the Texas Administrative Code, informed medication consents must be obtained for each individual medication, not by medication class. Informed consent for the administration of each psychoactive medication will be evidenced by a completed copy of the consent for treatment with psychoactive medications here at JPS. Consent must be obtained before the first dose of medications for scheduled or PRN psychoactive medications. All components of the consent must be completed. A new consent will be obtained if a change to a different medication is prescribed. If the RN, LVN, PA, or RPH gives the initial explanation of the medication information to the patient, then the treating physician must confirm the explanation and the consent. Then sign the consent within 2 working days. We will now begin a review of neurotransmitters. To begin, serotonin. This is a neurotransmitter which affects mood, sleep, sexual function, digestion, concentration, bone health, and even blood clotting. Much of the serotonin in our bodies is found in our gut, but can be found throughout most of our body in smaller amounts. Low levels of serotonin can cause anxiety, mood instability, GI dysfunction, and impaired wound healing. High levels of serotonin can cause muscle rigidity, fever, elevated pulse, and blood pressure, sweating, confusion, seizure, and death. Norepinephrine, this neurotransmitter, plays an active role in the fight or flight response. Prolonged stress can lead to norepinephrine deficiency, and imbalances in norepinephrine have been linked to sleep disorders, ADHD, depression, and anxiety. Some antidepressants stimulate the activation and use of norepinephrine. These drugs are often used to improve the fatigue and mental fog some experience in depression. Dopamine. Dopamine is the primary chemical responsible for the human brain's reward system. It is also a major contributor to our motor system, cognitive function, arousal, and motivation. Drugs of addiction activate large amounts of dopamine, which stimulates the reward system and can lead to cravings and psychological dependence. Patients with Parkinson's disease have a decreased amount of dopamine due to loss of dopamine-producing cells in the brain, and they experience many motor and cognitive symptoms. Since some antipsychotics, particularly the phenothiazines, block the effects of dopamine, patients taking these drugs can experience similar motor symptoms seen in patients with Parkinson's. Acetylcholine. These cholinergic system responds to acetylcholine and stimulates communication between motor neurons and muscle cells. Degeneration of cholinergic system resulting in low levels of acetylcholine are seen in patients with Alzheimer's. Drugs that inhibit the function of acetylcholine are called anticholinergics, such as Benadryl or Cogentin, can reduce muscle spasms, improve motor symptoms in Parkinson's, and reduce nausea. However, anticholinergics can exacerbate symptoms of dementia and should be used cautiously in patients with this diagnosis. Glutamate. This is the body's main excitatory neurotransmitter. Glutamate stimulates nerve cells and is integral in the communication between nerves and the formation of memories. Excessive glutamate can cause exotoxicity resulting in nerve degeneration, seizures, and brain damage. It is believed that overproduction of glutamate in parts of the brain may be a contributing factor in psychosis in schizophrenia. GABA. Low levels of GABA can result in anxiety, seizure, pain, and insomnia. Excessive GABA can cause depression, sleep disorders, drowsiness, and paradoxical reactions resulting in anxiety and discomfort. Benzodiazepines and alcohol stimulate GABA, and long-term use can alter the body's ability to modulate its own levels of GABA. Sudden withdrawals from alcohol or benzodiazepines can cause an abrupt deficit in GABA, resulting in a neurological excitatory response. This includes elevated blood pressure, pulse, temperature, seizures, delirium. Side effects syndrome refresher. Neuroleptic malignant syndrome is a life-threatening reaction to a neuroleptic medication. Antipsychotics, characterized by fever, muscle rigidity, elevated heart rate, delirium, seizures, rhabdomyolysis, and potentially death. In these cases, discontinue medication and treat as a medical emergency. Extrapyramidal symptoms, motor side effects, most prevalent in typical antipsychotics, which affect the extrapyramidal system of the brain, responsible for skeletal, muscle tone, and posture. EPS symptoms can include dystonia or sudden muscle contractions or spasm, akathisia, internal and motor restlessness, Parkinsonism, Parkinson-like symptoms related to dopamine blocking effects, and tardive dyskinesia, repetitive involuntary movements, which are sometimes irreversible and often seen in long-term use. In these cases, notify the provider and anticipate the use of an anticholinergic antagonist agent such as cogentin. Metabolic syndrome, a cluster of several symptoms including central obesity, hyperlipidemia, hyperglycemia, and insulin resistance, resulting in development of type 2 diabetes, hypertension, gynecomastia, and cardiovascular disease. Atypical antipsychotics are notorious for causing these side effects profile. In these cases, monitor metabolic panels, A1C, weight, and blood pressure. Agranulocytosis, characterized by a significant drop in granulocytes, types of white blood cells that include neutrophils, basophils, and eosinophils, greatly impair the immune system and make the patient susceptible to infection and septicemia. Clozaril is typically the drug associated with this disorder, but other psychiatric and non-psychiatric medications can induce agranulocytosis. In these cases, monitor white blood cells. Serotonin syndrome, a drug interaction between serotogenic drugs and many other substances, including illicit drugs and pharmaceutical drugs, resulting in a cascade of serotogenic activity. Symptoms include restlessness, agitation, abdominal cramps, diarrhea, hyperreflexia, confusion, diaphoresis, can lead to renal failure, coma, and death if not treated. Discontinue the medication and treat as a medical emergency. Myocarditis and cardiomyopathy. Cases of myocarditis, some of which have been fatal, and cardiomyopathy have been reported in patients on clozapine. Monitor their temperature, EKG changes, and CBC. Platelet activity. Serotonin is stored in platelets to function as an antithrombotic. Serotogenic drugs can reduce platelet activity and may pose a risk for bleeding, especially in patients with blood disorders, liver disease, and GI conditions. Monitor for bleeding and CBC. Hyponatremia. A number of psychotropic medications can cause hyponatremia. There is a particular increased risk for some medications. Examples would be SSRIs and venlafaxine. And for older patients or those taking other medications affecting sodium. Example would be diuretics. Symptoms include delirium, gait disturbances, impaired consciousness, and seizures. In these situations, monitor for symptoms and BMP. Classes of medications. Antidepressants. Side effect profile can range from very mild to life-threatening and vary greatly depending on the type of antidepressants. Primary goal is to improve mood and reduce depression, but they can also be used to treat nicotine dependence, obesity, narcolepsy, eating disorders, ADD, ADHD, and chronic pain. Some categories of antidepressants can cause anticholinergic effects. Selective serotonin reuptake inhibitors include those listed below. They block the reabsorption of serotonin in the brain. Common side effects include headache, nausea, drowsiness, sexual dysfunction. Serotonin norepinephrine reuptake inhibitors, SNRIs, include the medications listed below. These block the reabsorption of serotonin and norepinephrine in the brain. Used to treat depression, OCD, anxiety, ADHD, and pain disorders. Rare, severe side effects would include serotonin syndrome. Special considerations, black box warning for adolescents, young adults, increased suicide risk. Antidepressant withdrawal symptom are flu-like symptoms, sensory disturbances, brain zaps, and insomnia. Norepinephrine and dopamine reuptake inhibitors, NDRIs, include bupropion or Wellbutrin. Block the reabsorption of norepinephrine and dopamine in the brain, used to treat depression, ADD, ADHD, narcolepsy, smoking cessation. They have a stimulant effect, although the intensity varies between drugs. Special considerations, please monitor patients' blood pressure in patients with hypertension, seizures, especially at higher doses, and patients with epilepsy. Black box warning includes increased suicide risk. Tricyclic antidepressants, or TCAs, include those listed below. These block the reuptake of serotonin and norepinephrine, blocks receptors for histamine and acetylcholine, as antihistamines and anticholinergic properties, used to treat resistant depression, anxiety, eating disorder, OCD, PTSD, headache, insomnia, and neuropathic pain. Common side effects include cognitive or memory impairment, sexual dysfunction, drowsiness, and weight gain. Antihistamine and anticholinergic side effects include dry mouth and nose, blurred vision, constipation, and urinary retention. Rare/severe side effects include cardiac arrhythmias and oversedation. Special considerations, TCA overdose is toxic to the cardiovascular and neurological symptoms. Monitor self-administration in patients at risk for suicide. Monoamine oxidase inhibitors, or MAOIs, include those listed below. MAOIs inhibit the actions of an enzyme that removes certain neurotransmitters. Common side effects include headache, nausea, drowsiness, fatigue, dry mouth, orthostatic hypotension, weight gain. Special considerations, many drug interactions, mood stabilizers, over-the-counter cold medicine, St. John's wort, cycloclobenzaprine. Rare side effects would include hypertensive crisis, thiamine diet. Thiamine is an amino acid that regulates blood pressure. MAOIs block the breakdown of excessive thiamine, and this can cause an increase in blood pressure. You should avoid aged cheeses, cured, processed smoked meats, pickled or fermented foods, soy, dried fruit, ripe fruit, yeast extracts, meat tenderizers, alcohol, prepackaged sauces such as teriyaki sauce, and caffeine. Always monitor for increased risk of suicide. Atypical antidepressants include those listed below. do not fit into a traditional antidepressant category and work in various ways to increase the amount of serotonin, dopamine, and norepinephrine availability. Common side effects vary between each drug. Most common are dry mouth, dizziness, weight gain, increased appetite. Rare severe side effects would include trazodone, priapism, and Remeron sedation. Anxiolytics, or anti-anxiety. These medications are also different subcategories and can be given for a few different reasons. We may give these to reduce anxiety in conjunction with other medications during a behavioral emergency, or to manage withdrawal symptoms. One subcategory of these drugs, benzodiazepines, can be highly addictive and should be used cautiously. Benzodiazepines includes those medications listed below. These enhance the action of GABA in the body, decreasing the excitability of neurons. Potential for dependence is great due to addictive nature of benzos. Common side effects include dizziness, drowsiness, confusion, amnesia, and unsteady gait. Special considerations. Withdrawal can be life-threatening. These are category D or X in pregnancy. Some antibiotics, antidepressants, antifungal agents, and oral birth control can cause increased accumulation of benzos and increase their effect. Avoid long-term use, especially in elderly, due to the risk of cognitive impairment. Rare, severe side effects include CNS depression in overdose, respiratory depression, apnea, hypotension, bradycardia, and arrhythmias. Non-benzo medications. Medications from several different drug classes can be used. Mechanism of action and side effects vary depending on drug class. Include antihistamines, hydroxyzine or Vistaril, block histamine receptors and interact with serotonin receptors to reduce anxiety. They are non-habit forming and generally considered to have low side effects. Busvar is similar to an SSRI, but only acts upon subset of serotonin receptors. Alcohol can increase sedation. Antidepressants, primarily SSRIs. Some antidepressants can trigger mania in those with bipolar disorder, sexual dysfunction, black box warning, suicide risk. Beta blockers, propranolol and atenolol, act on the CNS to decrease physiological response to anxiety, can lower blood pressure and pulse. Monitoring is required. Gabapentin is designed to mimic the structure of GABA, can cause sedation, small potential for addiction. Antipsychotics. As the name implies, these are often given to treat signs and symptoms of psychosis. However, they may also be given to treat mania or boost the effects of antidepressants. Antipsychotics are also very typically given in behavioral emergencies. There are many subcategories of antipsychotics, and they all have side effect profiles that we must monitor closely. The goal for patients with schizophrenia is to treat 3 types of symptoms. Positive symptoms include hallucinations, delusions, anxiety, and paranoia. Negative symptoms include apathy, blunted affect, motivation, and anhedonia. Cognitive symptoms include impaired memory, inability to concentrate, and difficulty abstracting. Typical antipsychotics may be called by other names related to their unique characteristics and historical development. First generation were developed in the 1950s as the first pharmaceutical interventions for many psychiatric symptoms. Prior to these treatments, including lobotomies, electroconvulsive therapy, and insulin coma therapy. Dopamine antagonists block dopamine receptors, reducing the effect of dopamine on the brain. Drugs other than antipsychotics are also dopamine antagonists, such as promethazine. Dopamine theory of schizophrenia includes excessive dopamine produces the positive symptoms. Phenothiazines have antipsychotic and antiemetic properties, extensive side effects, most notably motor-related symptoms or EPS, hyperprolactinemia, weight gain, and the potential for neuroleptic malignant syndrome, photosensitivity, lower seizure threshold, hypotension. These include the medications listed below. Butyrophenones have antipsychotic and antiemetic properties. They can cause significant sedation, can induce prolonged QT intervals. Risks are greatest in patients with cardiac illness, significant risk of motor and neurological side effects. They can induce pseudoparkinsonism related to dopamine blocking effects. They include the medications listed below. Atypical antipsychotics, also known as second-generation antipsychotics, were developed to produce less motor/neuro symptoms than typical antipsychotics, while still relieving psychotic symptoms. These are more widely used in psychiatry currently for this reason. However, they have their own unique side effects that should be considered and monitored. Medications of this drug class are listed below. These drugs are dopamine antagonists, but are selective to certain dopamine receptors, thus reducing side effects. Some of them also act on serotonin receptors, and serotogenic effects are seen in use. Common side effects include dry mouth, dizziness, drowsiness, and sexual dysfunction. Most significant side effects are related to metabolic changes or metabolic syndrome, which include weight gain, obesity, hyperlipidemia, which leads to cardiovascular disease, insulin resistance, leading to elevated glucose, leading to type 2 diabetes. These still have potential to cause EPS and other motor symptoms. Mood stabilizers. Lithium is used for the treatment of bipolar disorder, reducing mania and balancing mood. This medication takes several weeks to reach therapeutic effects. Common side effects include weight gain, dry mouth, slight tremor, increased thirst. Rare, severe side effects include toxicity, severe tremor, or lack of coordination. Special considerations. Lithium can be toxic to kidneys and the thyroid. Use cautiously in patients with a history of kidney or thyroid disease. This is a pregnancy category D medication, and it is shown to produce cardiac effects in the first trimester. Avoid NSAIDs. NSAIDs increase the potency of lithium and can cause renal toxicity. Anticonvulsive medications include those listed below. Originally designed to control seizure disorders, but were found to effectively treat mood disorders and manage mania. These medications can take several weeks to reach therapeutic effects in some cases. Common side effects include dizziness, drowsiness, fatigue, nausea, and tremor. Rare side effects include lamictal rash requires immediate discontinuation of the drug, toxicity, Depakote, Tegretol, lamictal, we must monitor serum values, and hepatotoxicity, Depakote, monitor liver enzymes. ADD, ADHD medications. Stimulants include those listed below. These medications increase dopamine and norepinephrine in the brain. They improve focus, reduce fatigue, and increase executive function. Common side effects include decreased appetite, insomnia, dilation of pupils, irritability during rebound, increased heart rate, and blood pressure. Rare or severe side effects include decreased seizure threshold and psychosis. Special considerations, black box warning, avoid use of amphetamines in patients with cardiac conditions, risk of sudden death. Monitor weight, especially in children, as growth impairment can occur. Dependence and abuse of stimulants is a significant risk due to their addictive nature. Non-stimulants include the medications listed below. Mechanism of action varies greatly depending on the use of the medication. Hypnotic sleep aids. Melatonin. is a hormone made by the pineal gland that regulates sleep. Can be found over the counter. It is safe to use in many cases, first line for children. Ambien is a sedative hypnotic GABA receptor agonist. It increases the effects of GABA on the brain. There is a potential for abuse and addiction. Sleepwalking, sleep eating, and sleep driving. Use extreme caution when giving to the elderly. Trazodone is a typical antidepressant, serotonin agonist, and reuptake inhibitor. It increases available serotonin. They may have a next day hangover feeling. It can also prolong QT and serotonin syndrome. Benadryl is an antihistamine. Histamines mediate wakefulness. Blocking these properties can result in drowsiness. Other miscellaneous drugs. These drugs may not fit into traditional psychotropic medication categories, but are effective in treating psychiatric signs and symptoms. Please read examples below. Long-acting injectables. Long-acting injectables are used to deliver long-lasting antipsychotic or mood stabilizers with therapeutic effects lasting weeks or months. Some require overlap with oral drugs and others do not. Abilify and Risperdal require oral overlap. Invega does not. These can be very expensive medications, so be confident that you are administering them correctly. Check the manufacturer's recommendations on administering first dose and maintenance doses. It may not be in the location you think. Examples: the initial dose of Risperdal Consta goes in the deltoid. Olanzapine palmitate requires monitoring for 3 hours after administration to detect rare but potential delirium. Laboratory monitoring and toxicities. Lithium, Depakote, Tegretol, and Lamictal must be in therapeutic ranges. Toxicity in Depakote includes symptoms such as altered mental status, seizure, CNS depression, cerebral edema, pancreatitis, hyperammonemia. Toxicity in lithium include GI distress, nausea, vomiting, fatigue, gross tremors, seizures, exaggerated reflexes, kidney failure, and delirium. Monitor blood pressure when using Effexor, MAOIs, and Wellbutrin. Monitor liver enzymes with Depakote and Tegretol. With antipsychotics, we must monitor for metabolic syndrome, as well as prolonged QT intervals. That includes visualization of EKG, A1C, weight, and lipids. With clozaril use, monitor white blood cells. With SSRIs in the elderly, monitor for hyponatremia. PRN versus emergency medications. PRN medications require a written consent. These are given to patients as needed by the nurse per orders indicated, as well as appropriate time intervals. PRN medications are normally an oral medication. Emergency medications do not require a written consent. These are given to patients during emergency situations. The nurse must call a provider to obtain an order for emergency medications. These medications are normally in an injection form. Below, you will see mild agitation, moderate agitation, and severe agitation examples. Safe medication administration. Always use your 2 patient identifiers: name, date of birth, medical record number. Always scan the barcode on the patient's wristband. Scan the barcode on the medication. Addressing warnings when they appear in the EMR. This may include a partial dose or early administration or other warnings. During insulin administration, 2 RN nurses must verify during the process. You will now continue to the medication test.